Varicose and spider veins don't just affect the way your body looks, they can be uncomfortable and painful. Here with more is Dr. Dale Payne, cardiothoracic surgeon at Arizona Vein and Laser Institute. Good morning.
Hi, good morning, Gina. How are you?
Good, great to see you.
Nice seeing you too.
So we know that millions of Americans suffer with varicose veins. Why do they wait so long or just ignore them?
Well, I think that's the whole thing, is they ignore them and they think that they're benign. Most people look at their veins as the spider veins, especially, as little fine web-like structures, and men in particular just let it go, and until it gets almost untreatable when they get ulcers and stuff. But women who look at their legs more often, and of course they shave their legs more often, they see the veins that are there, and they want something done about it, since especially for the summers and the springs when they want to start wearing shorts and swimsuits, and so that's the time they start asking questions about it.
Well, especially here in Arizona, like you said, where we're wearing those shorts and swimsuits and so forth so much. Now, there was something that they used to do called vein stripping. Are they still doing that?
You know, we don't do too much vein stripping in the United States anymore. I think some countries they probably do, especially some third world countries. I see people that have come back after vein strippings. That was a procedure where an incision was made just above the knee and then one at the groin. The vein was located and a thin rod was placed up the vein, and then on the tip of the rod at the groin, another little button-like device is screwed on, and then the whole vein is pulled out.
Wow.
Usually it's done under general anesthesia, and then the pressure has to be applied to control the bleeding, which eventually stops. But that's kind of an archaic way of doing it now. Now it's done with laser.
Now it's done with laser.
Correct.
And you brought along a picture for us to kind of understand and see how this all works. Can you explain it to us?
Yeah, this is endovascular laser treatment, or endovascular laser ablation, what it's called, and where an area under ultrasound is located at the vein that we're dealing with. Lidocaine is injected in the area, a needle is inserted into the vein under ultrasound guidance. A small optic fiber is placed in the vein itself up to the point that you want to start the ablation. Anesthesia is given again along the vein, and slowly the laser, once it heats up and connected to the laser device, and the laser beam goes through the fiber, heats up at the tip, and that laser optic fiber is pulled down slowly, and it burns the vein and destroys it.
So how has this changed kind of your industry and the results that you get for patients?
Well, the results are mainly excellent. You know, 99.9%, the vein is gone forever, and it resolves many of the problems that people have with the varicose veins.
And besides aesthetics, why should people pay more attention to some of these veins and the vein problems that they're having?
The problem is if you let it get worse, and they do get worse, and they may not look bad at first, but over a period of years they get worse. And some people, it becomes a life-saving situation, since people especially are prone to certain infections or have diabetes. They can develop ulcers at the ankles where the blood pools, and that can develop into an infected ulcer, which has to be treated in a little different manner. But in general, most of these varicose veins are not life-threatening. But they cause a lot of problems. They cause problems with leg fatigue, restless leg syndrome sometimes, a lot of pain and itching and discomfort, and people don't like the way they look.
And you've got 5 locations in the Valley.
That's
and
correct.
You work mostly at the Chandler location, is that right?
I'm mainly at the Chandler location. And I also work at wherever I'm needed at the time where the patient wants to go to see me.
And you've got a special offer for our viewers to make it really easy for them to come see you.
That's correct. They can call and have a free vein screening. We also, for seniors, we have a shuttle service that will take them throughout different parts of the Valley to the location itself.
All right. Well, Dr. Payne, thank you so much.
Thank you, Gina.
And if you'd like more information on Arizona Vein and Laser Institute, log on to their website, ArizonaVeinandLaser.com, or call the number you see on your screen.